Okay, here we go.
1,
2, 3, 4, 5,
6,
7,
8, 9,
10.
11.
12.
Okay. Every night I can promise you that at least one elderly resident in a nursing home cries themselves to sleep every night because of their poor treatment due to their lack of money. Every day at work, I see elderly people mistreated on a daily basis due to the kind of health insurance that they have. If you have grandparents and great-grandparents living in a nursing home, do you want them to be treated with disrespect just because of the kind of insurance that they can afford? For someone to be treated differently over the kind of insurance that they are able to have is absolutely sickening. I see this happening every day, and that is why part of me has to believe that if the United States were to switch over to universal health care, then the world would be a better place and my patients would all be treated with equal respect. Although a lot of people would disagree with this statement and it sounds crazy, please allow me to give you the best insight that I possibly can on what I'm trying to show you. I am sure that there are probably 1,000 reasons why this topic is a good or a bad idea, and I do take all of those reasons into consideration. But today I'm going to use the elderly as my prime example to show you why the United States should switch to universal health care. Please keep an open mind and take a look at my perspective of how the elderly people's lives should be lived throughout my speech. There is a major difference between Medicaid versus Medicare. That difference has nothing to do with what is paid towards Social Security or who is rich with money or poor with no money. That difference is the bed that your grandparents and great-grandparents sleep in, the care that they receive, the size of their rooms, the food that they eat, and the respect that they get. According to an article written in Vox Healthcare by Sarah Cliff on January 20th, 2015, it is stated perfectly that we pay doctors when they provide lots of health care, not when they provide good health care. That statement is true on so many levels. The amount of money you have sadly controls the amount of good health care you are going to receive. It is also stated in an article written by Thomas Day in the National Care Planning Council titled Americans' Attitudes on Aging that as Americans age, we fear the deterioration of our bodies and the possible lack of security due to low income. The elderly are people too. They do not deserve to worry about growing old because of the lack of respect and security that they are going to receive. No one should fear growing old because of that ridiculous reason. The elderly should grow old happily and knowing that they lived an amazing life and that they are going to receive the care and security that they deserve. Universal health care makes it easier to have everyone under one system so that healthcare providers can concentrate on patients and their problems without the insurance companies trying to make money off of the elderly. According to an editorial in Balanced Politics about whether or not the government should provide universal health care for all Americans, it is stated that the number of uninsured U.S. residents has grown to over 45 million. Another article written by Catherine Schwartz titled Healthcare for the Poor, For Whom, What Care, and Whose Responsibility? This article states that there is an underlying approach assuming that if poor people have health insurance, physicians and other providers of medical care will provide the same services to poor people as they do to middle-class people. As experience with public insurance has grown, it has become clear that poor people face barriers to obtaining health care beyond simply their inability to afford it. I want to live in a world where all elderly Americans are treated equally. It sounds surreal that something like that could actually happen, but it could. My goal here today is to show you how your grandparents and great-grandparents are being treated, and hopefully make you realize that something has to be done to change this. If the United States were to switch to a universal health care, then each elderly individual would receive an equal amount of support by the government. There is an article written in the PNHP, Physicians for a National Health Program, by Julie Pease, MD, that says we must move beyond the bureaucratic, complex, expensive and limited reforms offered by the Affordable Care Act. Instead, we need to improve the popular Medicare program and expand it to cover everyone. Replacing the current healthcare system with an improved system of Medicare for all would improve the nation's health. It would save lives and save money. People will no longer have to worry about the cost of being treated and the respect that they are going to receive due to the kind of insurance that they have. Healthcare providers will have no choice but to treat each person equally with the same amount of care and respect. Death rates in our country would drastically descend, and the mortality rates will greatly expand. Now that this Now I know this sounds crazy and a lot of people would probably disagree with me, but without looking at all the other factors that are associated with this concept, just think of the elderly, your grandparents and your great-grandparents. Do you like the fact that they are being singled out and disrespected over the type of insurance that they have? Do you sleep good at night knowing that your grandpa or grandma could be laying in pain and that nurses and aides are just looking the other way due to their insurance? Imagine a world where all people are treated medically equal, where you are able to walk into a nursing home and see that each individual is being treated with the same equal care and respect as the person beside them, where each room is the same size and one isn't favored over the other. Imagine walking into a nursing home where every resident in there has a smile on their face and is actually happy. Seeing that would make me the happiest person on this earth. The elderly deserve so much from us. They deserve at least to live the rest of their lives happily with not one person favored over the other. They deserve to live the rest of their lives in a world with universal health care. There are many arguments to the thought of a universal health care, many judgments made by lots of people who are selfish and stubborn, people who can't take a step back and look at the bigger picture. Many people would argue that they paid their Social Security taxes fair and square and have worked hard to be able to have the health insurance that they do and that they have earned it. This may be partly true, but most of the people who are able to state this are all either born wealthy or at least into the middle class. Other people may argue that people who are not able to pay their taxes or can't afford health care don't deserve care anyways. Not every person on this earth is born lucky like that. Many people are born into the lower class. They are raised up poor and that is all that they know. They weren't even given the chance of being insured and well taken care of, and many of them wouldn't even step foot near a hospital or even the thought of living in a nursing home because of the simple fact that they know that there is no way that they would ever be able to afford anything like that. Many of them would choose to die rather than to step foot near a hospital or nursing home to receive the care that they need. For someone to deny themselves medical care, the medical care that they need just because of the fact that they can't afford it is unbelievably sickening. I strongly dislike living in our country knowing that things like this happen every day. The United States of America is known for its equality and fairness. What a joke that is. In my speech today, I discussed the following things. Every day, an elderly person is treated unfairly and poorly due to the type of insurance that they have or may not have. My solution is that the United States needs to switch to universal health care, causing each individual to be treated medically equal. Do you like the thought of your grandparents being treated with disrespect because of the insurance that they have? I don't take this topic lightly, and it is in my opinion that no individual should be treated with such disrespect. I don't care how hard you have worked or how lightly you have worked. It shouldn't matter. What matters to me is that every person in this world receives an equally fair care that they need. Also, to give each person a purpose to go home every night knowing that they were taken care of and are able to get the care and respect that every person in this world so much deserves. Done.
Awesome.